Hello, my name is Alexis Lindsay, and I am the lead navigator at Palmetto AIDS Life Support Services, or PALSS, in Columbia, South Carolina. PALSS is a nonprofit organization with 35 years of service in HIV prevention and treatment. Over the years, our services have expanded to include mental health and social support services for people at risk of HIV infection or living with HIV. We understand that the HIV epidemic in South Carolina is a complex public health problem and cannot be extinguished without collaboration within our public health system. Law enforcement professionals play an important role in our community and have a unique opportunity to contribute to the fight against HIV and AIDS. The content covered in this training is intended to supplement and enhance, but not replace, existing safety standards that are governed by policy in your respective organization. Please ensure that you have completed the required training pre-assessment before viewing this training video. By the end of this training, we hope that you will have gained the following: an improved understanding of the transmission, prevention, and treatment of HIV and hepatitis C to support officer safety practices, an increased knowledge of the behaviors that put someone at risk of HIV infection and how to reduce these risks, an increased awareness of stigma and discrimination against people at risk for HIV infection and persons living with HIV, and lastly, to encourage further collaboration between law enforcement officials and community-based organizations to enhance community policing. Understanding HIV and hepatitis C. The human immunodeficiency virus, or HIV, is a viral infection that damages the immune system. If left untreated, HIV infection can lead to the development of acquired immunodeficiency syndrome, or AIDS, which is a condition where the immune system is too weak to fight off certain infections. AIDS is the most advanced stage of HIV infection, and most people living with HIV will not develop AIDS if they begin treatment soon after becoming infected. HIV can be transmitted through different bodily fluids, including blood, breast milk, vaginal secretions, and semen. Not everyone who is infected with HIV will present with physical symptoms, but about 2/3 of people who are infected with HIV will experience flu-like symptoms within 2 to 4 weeks after being infected. This is known as acute HIV infection. There is no cure for HIV, but it can be managed through antiretroviral therapy. Some behaviors can put someone at greater risk of being infected with HIV, including engaging in unprotected sex or having sex with multiple sexual partners, substance use before or during sexual activity, injection drug use and needle sharing, and men who have sex with men. The southern region of the United States accounts for more than half of new HIV cases annually. In South Carolina, African Americans represent 27% of the state's population, but comprise 68% of persons living with HIV in the state. Men who have sex with men is the highest reported risk factor for people living with HIV. And youth represent 19% of newly diagnosed cases of HIV infection. Richland County is home to 1/4 of the people living with HIV in South Carolina. Hepatitis C is a contagious virus that infects the liver. Hep C can lead to life-threatening conditions such as cirrhosis of the liver and liver cancer. The virus can be transmitted through contact with infected blood during needle sharing, sexual activity, or unsanitary tattoo and body-piercing practices. Hepatitis C is prevalent across all age groups, including young adults. In 2018, South Carolina Department of Health and Environmental Control reported 6,472 cases of chronic hepatitis C in South Carolina. So how can one protect themselves from exposure while on the job? Many of these safety tips are common practice and are likely required by your organization. However, it never hurts to remind folks how they can prioritize officer safety. Always slow down and think before doing anything. Assess the situation before acting to understand what you may need to do in order to protect yourself. Use protective gear when conducting body searches to prevent needle sticks. And never dig around in purses, pockets, book bags, cars, or anywhere a needle can be obscured without first putting on frisk gloves or cut-resistant gloves. Consider putting disposable gloves over your leather frisk gloves to serve as a contamination barrier for your reusable gloves. The safest way to remove disposable gloves is by using what I call the overhand method. So when using the overhand method, you want to first make sure that you are utilizing disposable gloves that are your size and fit your hands appropriately. Once you have used the gloves, done all that you need to do, and are ready to dispose of the gloves, you want to use the overhand method as the safest method to remove these gloves to minimize contamination to your arms, wrists, or your hands. So having your gloves on, you want to ball your hands up in a fist with the tops of your hands facing upwards. And you want to first start by taking off one glove using your index finger and your thumb finger. You want to grab the base of the glove, pulling upwards, ensuring not to touch your skin. Pull upwards and towards the front, rolling the glove off of your fingers, wiggling your fingers out. And then you want to use your gloved hand to grab that glove and pull it off, balling it up into your fist like so. You'll repeat the process to take off your second glove using your index and your thumb finger to pinch the top of the glove at the base like so, ensuring again not to touch your skin. You want to pull off in a similar manner, wiggle your fingers out, and ball both gloves up into one fist and dispose of properly. We know that things can be unpredictable in the field, and circumstances can prevent you from taking precautionary measures in advance to protect yourself. In this case, you will want to make sure that you secure your scene as soon as possible, immediately wash or sanitize your hands, and then put on protective gloves. You want to immediately inspect yourself for injury, looking for cuts, bruises, and open wounds. If needed, call EMS for yourself, your fellow officers, and any civilians who might need medical attention. The fight against stigma. In order to effectively combat the HIV epidemic, it's important that we raise awareness around stigma and the effect that it has on the prevention and treatment of HIV. Dr. Kristalyn Stalters-Pednault defines stigma as a perceived negative attitude that causes someone to devalue or think less of the whole person. Examples of stigma include the feeling that people deserve to get HIV because of their choices, and making moral judgments about people who take steps to prevent HIV transmission, including utilizing PrEP, which we will talk about in detail momentarily. Discrimination is known to be the behaviors that result from negative attitudes or beliefs that are characterized by stigma, or the acts of simply treating people differently. Examples of discrimination include refusing casual contact with someone living with HIV, socially isolating a member of a community because they are HIV positive, and a healthcare professional or really any other professional who refuses to provide care or services to a person living with HIV. Misinformation around HIV leads to many people living with HIV to experience negativity, prejudice, and abuse. Hurtful or offensive experiences to one's HIV diagnosis can discourage them from seeking the appropriate care. So let's look at a scenario of HIV stigma presented in the workplace. So you have a friend at work who says to you or remarks to you that another coworker shouldn't be participating in the office potluck because he or she has HIV. How would you respond? What could you say to that person in an effort to combat the stigma that you see being presented at that moment? You could respond to your friend's misconception kindly, of course, by explaining the facts. You could state, You don't need to worry. You can't get HIV from eating food handled by a person with HIV. Help your friend to understand that refusing casual contact with someone who is living with HIV is a form of stigma. And then model positive behavior by eating the food that your coworker has prepared, and have lunch with your coworker regularly to check in with them to make sure that they aren't feeling isolated and that they're doing okay. Substance abuse is linked to an increased risk of HIV infection. Stigma around substance abuse presents challenges to implementing substance abuse and HIV prevention programs in our community. Stigma has affected the public's perception of harm reduction interventions such as needle exchanges, substitution therapies such as methadone, and safe drug consumption rooms that are intended to decrease the risk associated with drug use. Research shows that needle exchange programs actually do not encourage drug use, and they in fact are associated with a decrease in HIV and hepatitis C prevalence. Gay, bisexual, and down low men carry the greatest burden of HIV in South Carolina and really across the nation, which reflects the vulnerability of the LGBTQ community. Social stigma is associated with high rates of depression, anxiety, substance use, and suicide among the LGBTQ population, exacerbating the risk of HIV infection among this community. When speaking of HIV prevalence in South Carolina, it is important to note why African Americans carry the greatest burden of HIV, not only in this state, but across the United States. Racial stigma is present in our social and political systems, creating an environment that perpetuates health inequities. Poor health outcomes among racial and ethnic minorities are called health disparities. Health disparities are attributed to unequal distribution of social, economic, and environmental resources due to the structure of our social and political systems. Let's take a moment here to take a 5-minute break. Feel free to pause your screen, get up, stretch, grab a drink of water, time yourself for 5 minutes, and let's resume here momentarily. In this section, we will talk about things that one can do to prevent or reduce their risk of HIV infection. The CDC has issued several recommendations to minimize the risky behaviors associated with HIV infection. These recommendations are for any and everyone, regardless of your race or ethnicity, gender, age, sexual orientation, occupation, or any other social identity. Be sure to use a new condom for every act of vaginal, anal, and oral sex throughout the entire sex act from start to finish. Reduce the number of sexual partners that one has, and limit or eliminate drug and alcohol use before and during sexual activity. Do not use illegal drugs, and never share needles with someone else. Always use disinfected needles or new sterile needles whenever possible. Lastly, be sure to talk to your healthcare provider about the risk associated with HIV infection and testing services offered for HIV and hepatitis C. Pre-exposure prophylaxis, or PrEP, is a prevention medication that can reduce the risk of getting HIV by about 99%. PrEP works by preventing the virus from taking hold in the body by disrupting the virus's replication process. PEP, or post-exposure prophylaxis, is very similar to PrEP. However, it is administered after a potential HIV exposure. PEP may be great to use as an emergency prevention method for law enforcement officers who are potentially exposed to HIV while in the line of duty. Anyone who has unsafe sex or has shared injection drug equipment should be tested for HIV at least once a year. High-risk professionals such as healthcare workers and first responders should be tested after a potential exposure to blood or other bodily fluids. Populations at a greater risk of HIV infection, such as sexually active gay, bisexual, and down low men, should be tested for HIV every 3 to 6 months. For hepatitis C, it is generally recommended that everyone receive testing at least once in their lifetime. Testing is strongly recommended for vulnerable populations, including adults who were born between 1945 and 1965, persons living with HIV, any person who has ever injected drugs or shared drug preparation equipment, such as needles or syringes, people who have received blood transfusions or organ transplants, and people who have received tattoos in tattoo parlors that are unregistered or unmanaged by the Department of Health and Environmental Control. Living a long and healthy life with HIV depends on immediately linking a client to care, engaging them in antiretroviral therapy, or ART, and ensuring that they are engaged consistently and continuously in antiretroviral therapy and care. ART is the medical treatment that is used to reduce the amount of virus found in the blood and bodily fluids, which is known medically as one's viral load. It is important to note that a viral load can be considered what we call undetectable and untransmittable. This means that one has engaged in continuous treatment of their antiretroviral therapy and have been able to reduce their viral load to an undetectable and extremely low amount. This means that an individual is incapable of transmitting the HIV virus through sexual activity with such a low viral load. We call this undetectable, which equals untransmittable, and it is important to engage in consistent and continuous care on antiretroviral therapy in order to maintain an undetectable viral load. Most STIs can be cured with antibiotic or antiviral medications, except for hepatitis B, herpes, HIV, and HPV, or human papilloma virus. There is no vaccine for hepatitis C, but the virus can be cured using antiviral medications. At this time, we will take another 5-minute break. Feel free to pause your screen, get up and stretch, grab a sip of water, and prepare for the next segment, which we will resume in 5 minutes. PALSS has recently launched a new program that focuses on HIV testing, prevention, and linkage to care for the populations in our community that are at greatest risk for HIV infection, including minority young adults ages 18 to 24. Our RISE program, which stands for Risk Reduction through Innovative Screening, Treatment, and Education, encompasses several approaches to HIV prevention. Through our RISE program, we provide rapid HIV testing and counseling services, including STI and Hepatitis C testing. We also offer training and technical assistance to our community partners. And to our community, we offer 3 HIV, STI, and substance abuse prevention programs, which include the Brief Alcohol Screening and Intervention for College Students, or BASICS program, our Video Opportunities for Innovative Condom Education and Safer Sex program, better known as VOICES, and Many Men, Many Voices, or 3MV. BASICS reduces the risk of HIV, STI infection by identifying and minimizing harmful drinking behaviors. The program is designed for young adults who engage in excessive alcohol use and are enrolled in an institution of higher learning here in the Midlands and surrounding areas. VOICES is a video-based HIV STD prevention program that aims to increase condom use among participants by teaching safe sex practices and improving condom negotiation skills. It incorporates culturally informed educational videos and small group skill building sessions as essential elements of the program. 3MV is a 6-session prevention program that uses group interaction to address behavioral risk factors that are specific to gay, bisexual, and down low men of color. 3MV aims to enhance self-esteem related to racial identity and sexual behavior, to educate clients about HIV risk and other sexually transmitted diseases, develop culturally sensitive risk reduction strategies, and to build skills in partner communication and negotiation. Outside of RISE, PALSS offers other clinical and support services to its clients. Clinical services include primary HIV medical care, PrEP navigation, linkage to medical care and other health-related services, including transportation, prescription and insurance premium assistance, and specialized medical case management. Please note that some clinical and support services, such as transportation to medical appointments, are only available for our clients living with HIV. Support services include mental health and behavioral health counseling, sexual health education, dental and optometry referrals, training in budgeting and financial management, and other services. For persons living with HIV, we also offer housing case management, emergency assistance for rent, mortgage, and utilities, and we have an emergency food pantry for all clients of PALSS, regardless of their diagnosis or services being received. behavioral and mental health services are offered through our Palmetto Family Service Center. Services offered include counseling services for individuals and families, anger and stress management, budget and debt management, and substance use assessment and treatment. We also offer treatment for mood and depressive disorders, anxiety and panic disorders, PTSD, and attention deficit disorders. Community partners are welcome and encouraged to use the referral link on the PALSS webpage. The referral link can be found under the RISE program and is a great resource to use to refer anyone you may know, including yourself, who may be in need of a service that we offer. This is the referral page on the PALSS website. It includes an explanation of our RISE program, as well as an option to indicate whether you are making a self-referral or a community referral on behalf of a client or a community partner. You would include the client's information, contact information, including name, email address, and phone number, indicate the services that are needed, whether or not they're being referred to one of our evidence-based prevention programs, counseling services, or even testing services as needed. And then it gives you the opportunity to indicate the reason for the referral, detailing any specific events or behaviors that would prompt you to make that referral. And then you would submit it to one of our RISE staff, and we would designate it within our organization to the appropriate department, including the RISE department itself. And with that, I will thank you for joining me in today's training. I hope that you took something valuable away from this training and that you learned something that you could reasonably apply within your work. If you want to stay up to date on the latest news and events happening at PALSS, please be sure to follow us on social media. We are on Facebook, Instagram, Twitter, and of course our webpage at pals.org. And you can always reach out to our RISE team. Dean Edwards is our RISE program manager, and his contact information is listed on the screen. And I am the lead navigator for the RISE program. We will also be bringing on a peer navigator who will support with program needs. Please reach out to any of us with anything that you need, any questions that you have, or concerns that are heavy on your heart. Additionally, please be sure to complete the online post-training assessment in order to receive credit for completing this training, and notify whomever in your organization or department that you have satisfied all training requirements. Thank you and take care.